Stop. Check your tongue right now. Right now, before you do anything else. Walk to a mirror, open your mouth, and stick it out. Most people see a tongue. I see an organ that is silently broadcasting the state of your liver, your heart, your gut, and your nervous system in real time. Every single morning, millions of people brush past the most diagnostic surface in the human body without giving it a second look. Not a glance, not a thought. And here is what nobody is telling you. The tongue shows the early warnings of vitamin deficiency, liver disease, cardiac inflammation, oral cancer, and gut dysbiosis weeks, sometimes months before any blood test will catch them. What you believe is just a pink piece of muscle in your mouth is actually the closest thing your body has to a public dashboard, and almost no one is reading it. Before I go one sentence further, I need you to do something. If this channel has helped you, hit subscribe. It takes 5 seconds. We are working toward 500,000 subscribers because the bigger this channel grows, the more people get the information that nobody in a clinic waiting room is going to give them. The system makes money when you stay sick, not when you get better. There is no billing code for teaching a 60-year-old woman how to read her own tongue at 7 o'clock in the morning. What I am about to tell you, no doctor on a 12-minute office visit is going to walk you through. Now, picture this. It is 6:30 in the morning. You are standing at the bathroom sink in the half-light, the cold tile under your bare feet, the faucet running. You feel tired in a way that coffee does not touch anymore. You have noticed your gums bleed a little when you brush. Your mouth tastes metallic for no reason. Sometimes, by 3 o'clock in the afternoon, there is a strange burning along the edges of your tongue, and you do not know why. You have already tried the multivitamin from the pharmacy. You tried the probiotic your daughter recommended. You went to your primary care doctor, who looked at your throat for 4 seconds with a wooden stick, said everything looked fine, and wrote you a prescription for acid reflux. You walked out feeling unheard. You walked out feeling like the problem was in your head. I see this in the eyes of hundreds of patients, and almost every one of them says the same thing. They say, I knew something was wrong, but nobody would actually look. Let me be direct with you. The belief that your tongue is just a muscle for tasting and talking is a lie. It is a dangerous illusion, and it needs to be shattered right now. Most people think the tongue is cosmetic. Men say, my tongue looks fine, why would I check it? Women say, I scrape it when I brush, that is enough. They have already tried mouthwash. They have already tried tongue scrapers from the drugstore. They have switched toothpaste twice. None of it has done anything because they were fighting the surface, not the cause. Your tongue is not the source of the problem. Your tongue is the sensor. Think of the smoke detector on your hallway ceiling. It does not start the fire. It tells you a fire is happening somewhere else in the house. The tongue works exactly the same way. The problem is not in your mouth. The problem is in your blood, your liver, your stomach lining, your circulation, and your immune system. The tongue is just the screen showing you the data. Before we go further, I need to say something as a physician with over 20 years of clinical experience. There are tongue symptoms that should send you straight to a doctor, not to a video. If you see a lump, a sore, a white patch, or a red patch on your tongue that has not healed in 2 weeks, that is not something to watch and wait on. That is an oral surgeon appointment this week. If you have unexplained numbness in part of your tongue, difficulty swallowing that has gotten worse over a month, or bleeding from the tongue that is not connected to biting it, those are also urgent. If none of those apply to you, you can breathe. You are going to be fine. But the quality of that life is worth protecting. So now we go deeper into the 7 signs that almost no one in a standard appointment will ever check for you. Here is what is happening in your body right now. The tongue is covered in tiny structures called papillae, which are the small bumps that give the surface its texture and contain your taste buds. Underneath those papillae sits one of the densest networks of blood vessels and nerve endings anywhere in the body. The tongue receives a fresh blood supply every few seconds. That means whatever is circulating in your bloodstream, whatever your liver is filtering, whatever inflammation is rising in your cardiovascular system, the tongue sees it first because the tissue turns over faster than almost any other organ. Researchers at Harvard Medical School have documented that changes in tongue color, coating, and texture often precede measurable changes on standard lab work by weeks, not days, weeks. A 60,000-person observational dataset from published clinical studies in Asia, where tongue diagnosis is part of mainstream medicine, found consistent correlations between specific tongue patterns and underlying systemic disease. Your tongue is the windshield. Everything you eat, drink, absorb, and fail to absorb is splattering against it in real time. The first sign is what is called geographic tongue. Look for irregular, smooth red patches surrounded by raised white borders that seem to migrate across the surface from one week to the next. Most doctors will tell you it is harmless. I want to be precise about this. Geographic tongue, in clinical terminology, benign migratory glossitis, is a localized inflammatory reaction of the tongue's surface epithelium. It is associated with autoimmune activity, psoriasis, and chronic stress on the immune system. It is your body telling you the immune system is misfiring somewhere, attacking tissue it should not be attacking. The map on your tongue is the same map drawing itself across your gut lining and sometimes your joints. That is not an exaggeration. That is physiology. The second sign is a thick white coating that does not come off no matter how many times you scrape. Most people see white film and think it's just food residue or poor hygiene. It is not. A persistent white coating, especially one that looks creamy and wipes off slightly to reveal a raw red surface underneath, is almost always a sign of Candida overgrowth, which is a fungal imbalance in the digestive tract that has migrated upward into the mouth. The mouth is the top of the digestive tube. The stomach is the bottom. They are the same tube. If Candida is colonizing your tongue, Candida is colonizing your gut, and that fungal load is feeding on sugar from your bloodstream every time you eat. A study published in The Lancet on gut dysbiosis confirmed that oral fungal markers correlate strongly with intestinal microbial imbalance. And here is what nobody is telling you. That coating is also why your breath smells different than it did at 40, why your energy crashes after lunch, and why you crave sugar at 9 o'clock at night. It is not willpower. It is a fungal organism asking to be fed. And the third sign is a tongue that is bright red at the very tip. The tip of your tongue, in traditional and modern integrative diagnostic frameworks, corresponds to the cardiovascular system. A persistently red, almost crimson tip, sometimes with small raised dots, is a sign of systemic inflammation centered in the heart and the surrounding vasculature. The endothelium, which is the thin inner lining of your blood vessels, is inflamed. C-reactive protein, the inflammation marker, is likely elevated on blood work you have not run yet. Researchers at Columbia University have shown that low-grade chronic inflammation precedes the majority of cardiac events by years. A red tongue tip is your early warning. Most cardiologists will not look at your tongue. They will look at your cholesterol number and send you home. The tongue saw it first. But before we go to the next sign, I need to say something as a physician that most people never hear. The reason these signs exist on the tongue and not somewhere else is because the tongue does not lie. Skin can be moisturized, eyes can be drops, hair can be dyed. The tongue is raw mucous membrane with no cosmetic interference. What you see is unfiltered. The fourth sign is scalloped edges. Look at the sides of your tongue. If you see waves, ridges, or tooth-shaped indentations along the borders, that is called crenation. Most people are told it means their teeth are pressing against the tongue and to ignore it. That is wrong. Crenation means the tongue is swollen and pressing outward against the teeth. The swelling itself is the diagnostic finding. It is most commonly caused by deficiency in B vitamins, particularly B12 and folate, which are required for healthy mucous membrane regeneration. It is also strongly associated with hypothyroidism, which is an underactive thyroid gland that slows metabolism and causes generalized soft tissue swelling throughout the body. Your tongue is one of the first places that swelling shows up because the tissue turns over so quickly. If your tongue is scalloped, you are very likely deficient, and your TSH, which is the thyroid-stimulating hormone measured on blood work, is probably worth checking. Write this down somewhere you will see it. I want to tell you about one of my patients. I will call her Gretchen Vasilenko. 61 years old, retired school teacher of 40 years, raised 3 children alone after her husband passed early, not someone who complains easily, only comes to see a doctor when she is past the point of managing. And she was past that point. She came in saying she was exhausted. She was cold all the time. She had gained weight despite eating less. 3 different doctors had told her it was just menopause, just aging, just stress. They ran a basic thyroid panel, said it was within range, and sent her home with a prescription for an antidepressant she did not want to take. When she sat down across from me, I asked her to open her mouth. Her tongue was pale, swollen, and scalloped along both edges so deeply you could count the indentations. I asked her one question that nobody else had asked. I said, "Gretchen, when did you last have your B12 checked? Not the standard range, the actual number." She said, "Never." We ran it that day. Her level came back at 198. Anything under 400 is functionally deficient, even though most labs flag it as normal only below 200. We also ran a full thyroid panel, including free T3 and reverse T3, which most primary care doctors do not order. Her free T3 was at the bottom of the range. I started her on sublingual B12, which dissolves under the tongue and bypasses the absorption problem in the stomach, and a low-dose thyroid support protocol. 6 weeks later, she walked back into my office, and the scalloping on her tongue was almost gone. Her energy was back. She had lost 8 pounds without trying. She looked at me and said quietly, "Why did nobody else look in my mouth?" The answer is because there is no billing code for it. The 5th sign is a deep crack running down the center of the tongue. A central fissure, which is a vertical groove down the middle of the tongue, is in many traditional and modern diagnostic frameworks associated with chronic digestive weakness and depleted stomach acid. As you age, your parietal cells, which are the cells in the stomach lining that produce hydrochloric acid, naturally decline in output. By 60, most people produce less than half the stomach acid they did at 30. That means food sits longer, protein does not break down properly, B12 cannot be absorbed because it requires intrinsic factor that is released alongside acid, and the entire digestive cascade slows. The tongue, which mirrors the gut lining, develops that central crack as the soft tissue thins. Researchers at Kyoto University have correlated central tongue fissures with measurable reductions in gastric acid output. And here is the part nobody tells you. Most people in your situation are taking acid blockers, like proton pump inhibitors, that suppress what little acid they have left. The medication is making the cause worse while treating the symptom. The 6th sign is a tongue that has a purple, blue, or dusky undertone instead of healthy pink. This is a sign of poor circulation, low oxygen saturation, or stagnant venous return. The tongue tissue should be a uniform pink to light red, well perfused, with visible but not engorged veins underneath. A purple tongue suggests that blood is moving through the body too slowly, that oxygen exchange in the lungs is reduced, or that the right side of the heart is working harder than it should. In some cases, it is the earliest visible sign of pulmonary or cardiovascular strain. A study from York University in Canada found that tongue color analysis using standardized imaging could predict circulatory abnormalities with significant accuracy. If your tongue has been getting darker over the last few years, that is not aging. That is your circulatory system asking for help. Lift your tongue and look at the 2 large veins underneath. If they are dark, swollen, and bulging like cords, your circulation is under strain right now. What comes next is the part nobody in a waiting room is ever going to explain. The seventh sign is the most important one. Lumps, persistent sores, white patches that do not wipe off, red patches with no clear edge, or any new growth on, under, or beside the tongue that has been present for more than 2 weeks. Oral and tongue cancers are among the most missed diagnoses in primary care because the average physical exam dedicates less than 15 seconds to the inside of the mouth. Survival rates drop dramatically the longer detection is delayed. Risk factors include tobacco use of any kind, heavy alcohol intake, chronic HPV infection, and persistent inflammation from poor oral hygiene or untreated dental disease. A lesion that bleeds easily, hurts when you press it, or feels hardened underneath the surface is not something to watch. That is a referral to an oral surgeon this week. I am not telling you this to frighten you. I am telling you because early-stage oral cancer is highly treatable. Late stage is not. Now, let me tell you what is happening at night because this connects to almost all 7 signs. While you are sleeping, between roughly 11 o'clock in the evening and 3 o'clock in the morning, your liver is performing the bulk of its detoxification work. If your liver is overloaded with hidden sugar from processed foods, hidden seed oils from packaged snacks, alcohol residue, or pharmaceutical metabolites, the overflow shows up on your tongue by morning as thicker coating, darker color, deeper cracks, or worsened scalloping. The foods most aggressively damaging your tongue picture are not the ones you would expect. Refined sugar feeds Candida directly. Industrial seed oils in salad dressings, packaged crackers, and restaurant fried foods drive systemic inflammation that surfaces as a red tip. Excess sodium from canned soups and deli meats causes the tongue to swell and scallop. Alcohol, even 1 or 2 glasses a night, dehydrates the tongue's surface and stresses the liver simultaneously. Write this down somewhere you will see it. Now I want to give you the protocol. I call this the morning mirror reset. It costs nothing. It requires only a mirror, water, and 90 seconds. Part 1, morning, the 90-second tongue read. The first 3 to 5 minutes after you wake up, before coffee, before brushing, before water, walk to the mirror and stick out your tongue. You are looking at the unfiltered overnight result of how your body processed the previous day. Note the color, the coating, the edges, the cracks, the underside veins, and any new spot. Do this every single morning. Within 2 weeks, you will know your own baseline better than any doctor. Within a month, you will catch changes within 24 hours of them happening. The reason this works is because daily observation builds pattern recognition that no annual physical can replicate. Part 2, the warm water flush. Drink 12 to 16 ounces of warm water with the juice of half a lemon within 10 minutes of waking. The warm water gently stimulates peristalsis, which is the wave-like muscular contraction of the digestive tract, and the lemon supports bile flow from the liver. Do this for 30 days and watch the coating on your tongue thin within the first week. The mechanism is simple. You are giving your liver and gut the hydration and gentle stimulation they were starved of overnight. Part 3, the tongue scrape, done correctly. Use the back of a clean, stainless steel spoon, not a plastic scraper. Gently draw it from the back of the tongue forward, 3 to 5 passes. Rinse. The reason a spoon works better than a plastic scraper is surface tension. The metal lifts the biofilm without irritating the papillae. Do this for 30 seconds every morning. Part 4. Target the cause based on what you see. If your tongue is pale and scalloped, start sublingual B12 at 1,000 micrograms daily and ask your doctor for a full thyroid panel, including free T3, free T4, reverse T3, and TPO antibodies. If your tongue has a thick white coating, eliminate added sugar and alcohol for 21 days and add fermented foods or a quality probiotic. If your tip is red, reduce industrial seed oils and processed foods and ask for a high-sensitivity C-reactive protein blood test. If your tongue is purple, Increase walking to 30 minutes daily and have your blood pressure and oxygen saturation checked. Part 5, the 2-week recheck. Take a clear photo of your tongue today in natural light, mouth fully open. Take another in 2 weeks. Compare. The tongue regenerates faster than almost any other tissue in your body. If your protocol is working, you will see it on the surface before you feel it in your bones. Gretchen did exactly this. She did the morning read, she did the warm water flush, she started the B12. 1 week later, she came back and said quietly, almost not believing herself, "I slept through the night for the first time in 2 years." After 1 more month, her tongue was pink, smooth-edged, uniformly colored, and she had returned to walking 3 miles a day with her grandchildren. The scallops were gone, the exhaustion was gone. The answer had been in her mouth the entire time. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers, because it will directly shape what I cover in the next videos on this channel. Here is exactly what to do after watching this. Step 1. Walk to a mirror in the next 60 seconds and look at your tongue. Step 2. Take a clear photo of it today in natural light. Step 3. Start the warm water flush tomorrow morning. Step 4. Match what you see to the 7 signs and target the cause. Step 5. Take a second photo in 2 weeks and compare. Your doctor is not going to walk you through this at your next appointment. There is no revenue in it, and there is no time on a 12-minute office visit to explain how the tongue mirrors the liver, the gut, the heart, and the immune system in real time. I am Dr. Candace Miller, and I have spent over 20 years watching what happens when people ignore the most diagnostic surface in their own body. Most of the time, the damage was entirely preventable. The protocol I just described requires no prescription, no procedure, no money beyond the spoon already in your kitchen drawer. It requires only the understanding of how your body actually works and the discipline to use that knowledge every morning. Subscribe to Dr. Candace, hit the like button, and help us reach 500,000 subscribers. Every person who subscribes makes it more likely that the next person who needs this information actually finds it. This video is for educational purposes only and does not constitute medical advice. Always consult a qualified healthcare provider before making changes to your health routine.